Hello, I'm Dr. Fernani from Village Veterinary Clinic, and I would like to help you better understand what to expect if your dog is in need of surgery. So, what do you need to know before your dog has surgery? Mainly, there are a few indications for surgery that we really recommend undergoing procedures. So, certain lumps and bumps, so skin tumors like mast cell tumors, we do want those off, and usually to send to the lab to see what kind of grade they are. Even benign tumors like lipomas or sebaceous adenomas that are in inconvenient areas of the body or that have gotten too large, we will recommend removal of those. Certainly there are emergency situations that require surgery, such as if your dog got into a fight or has any kind of laceration that needs to be sutured. We will have surgery done then, and then some other things as well. So commonly we will see surgery to remove stones, which is called a cystotomy, from the bladder. If your dog eats something and it is stuck in the stomach or intestine, that does require surgical removal. And sometimes we will do surgeries to help diagnose things. So if we have really high liver values, sometimes we will go in and actually get a biopsy of the liver to try and figure out what is going on. So will your dog need lab work prior to surgery? Yes, we do recommend for dogs under 6 that they have lab work, although we don't require it. If they're in ill health, if they are having like diarrhea or vomiting or weight loss or anything like that, we will maybe push a little bit harder, even on our young dogs, to have a pretty comprehensive lab work panel run. For my older dogs, and here we consider that age 6 and above, mostly for those large breeds, then we really do want our dogs to have lab work done, and that is to screen for kidney disease or liver disease that may need some additional attention. It may or may not be related to the surgery that we are actually doing, but that is often when we catch those things start to happen on our lab works. Does my dog need to see a specialist for their surgery? For most things, no. We can do simple mass removal, spays, neuters. We can do foreign object surgeries. We can do stone removals. Now, if your dog is in need of orthopedic surgery, yes, they will have to see a specialist. If your dog needs something done that is really complicated, like a rare tumor type that may need more tissue taken to achieve margins, or if it's in a very awkward spot like the top of the elbow, then we may refer you to a specialty center for those types of surgeries. What will my veterinarian be looking for in the pre-surgery lab work? So I mentioned it before, but primarily we're looking at liver and kidney values to make sure that your dog is safe to undergo anesthesia. We might also be looking for platelet values. So low platelets can be a sign that there may be excessive bleeding during surgery. If it is an emergency situation like a foreign body, we'll be looking for a level of hydration, because dehydration during those surgeries can certainly affect the outcome. And if it is an event that's really acute, like a dog attack or something like that, we will be looking for markers of shock, and we will try to treat those prior to undergoing anesthesia. Who will be monitoring my dog while under anesthesia? So this depends just a little bit on the clinic you're in. Here we have a technician monitoring and taking values every 10 to 15 minutes during the procedure. And of course the veterinarian is usually keeping an ear out for the EKG, pulse ox, any kind of alarm from the machine. Our machine is right here. We do EKG readings, which also measures kind of looking at the heart electrical activity. We have an SpO2 monitor, so look at oxygenation during the surgery and making sure that your pet keeps a pretty high level of oxygen running. That is this little value right here. This is our gas anesthesia tank, so we will adjust this if there's anything that's sending your dog too low, like low temperature, low heart rate. Usually we'll try to get this particular drug down to its minimal effective dose. We are also looking at things like blood pressure, and then we are running fluids for the entire surgery to make sure that we kind of maintain perfusion, because one of the things that happens is the blood pressure does tend to drop during surgery, and we want to make sure that blood is going to all the tissues of the body and keeping everything healthy while everything's kind of under anesthesia. How long will my dog need to recover after having surgery? So general healing time is about 2 weeks. Certainly some surgeries take longer, and if there is any complication, certainly that can draw out a surgical recovery. Probably the most common thing we see, especially on like limbs, is dehiscence that cause that to happen. How can I help my dog recover at home after surgery? So rest is definitely a big part of that, trying to make sure that there's not too much movement over the incision, making sure they keep some kind of barrier device like an e-collar on so they don't get to the incision is also a really big part of it. Certainly for more serious surgeries like a foreign body, there's going to be modifications to what they are eating and how often you are feeding that the owner will need to follow. If you have any questions for an upcoming dog surgery, please give us a call. We are happy to walk you through the process and to answer any questions you may have. Thank you.